Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Once again, time for the weekly update. And you'll note in this episode that there's a mix of data from September 3rd and today's September 7th, so be aware of that, because it may show something really important. And the summary is, at last week's end, there was no sign of any let-up yet, but over the weekend, just maybe. Across the United States, red zone's still expanding across the entire country, the Northeast and the upper Midwest filling in. And the states recently with the super high levels like Florida, Mississippi, Louisiana, Missouri, still really high, but all down off their peaks considerably. At the end of last week, there were 10 states in the orange, but 7 just below the threshold for red zone. As of today, Tuesday, there are 15 in the orange, with 8 just below the threshold. For our neighbors, with some of the highest rates of new cases in the country at last week's end. But for the first time in a while, 2 actually are now seeing a decrease as of today. South Carolina remains the highest rate in the nation, but Tennessee, which had the second highest rate last week, is down considerably, Georgia as well. North Carolina appears to perhaps have crested. On Friday, all counties in the red zone except for 1 county in orange, and now there are 3 counties in orange. Only one of those still close to the threshold for red zone. Hospitalizations, however, are going up, deaths markedly so. And note that these curves are now at the same levels as we saw last winter at the peak. But of course, we know hospitalizations and deaths lag cases. For Western North Carolina, at week's end, all were higher. But over this weekend, there's a definite trend downward for everyone. Testing positivity rates remain steady and high, not much change from the end of last week, and well above the 5% goal for those who are reporting. We can assume it's the same for those not reporting. Haywood County now at 5,809 cases at the end of last week. That represented an increase of about 286 over the previous week. As of today, 5,912. That was an increase of more than 100 over the holiday weekend. And they gave a week-over-week increase, however, of 269, a little bit lower. This, by the way, is the level we experienced for 10 days in January. And as of Friday, we've been at this level now for 9 days. As of today, for 13 days. So perhaps there is a decrease on the horizon. Deaths, 4 additional last week, another one today, all from August, giving us a total of 113 for the pandemic. And this time it does include some people younger than 50. And we've seen the most deaths now among Haywood County residents since January, eclipsing what we saw in February. Haywood Regional Medical Center has been seeing between 23 and 30 COVID-related admissions over the past 10 days, and that's the level they saw at the peak in January. They have been on diversion much of the past week and have been reducing elective surgeries on some days to preserve bed space. They're holding a lot of admissions in the ED at times, and those marked staffing shortages they are experiencing are just compounding the struggle to take care of everyone. Certainly, if you have a life-threatening emergency, they will take care of you. But if you could get your care elsewhere, it'd be a good thing to do. And I would say that it's the same for every hospital in Western North Carolina in terms of diversions and overwhelm. In fact, even Mission has had to go on diversion some days in the past 2 weeks, leaving EMS nowhere to go with their patients. And by the way, Haywood County EMS is now having to stack calls, which means pushing off less urgent calls in order to remain available for serious illness or injury. If we look again at the curve of cases compared to the UK and Missouri, you can see we have well surpassed Missouri. And perhaps we see a plateau, although not as high as the UK got here, but still higher than their current surge, which perhaps may be flattening as well. So the big question today is whether the downward trend we're seeing across North Carolina and Western North Carolina is real, or just the result of less testing and reporting over the holiday weekend. Each prior surge has followed a holiday. And this time, however, we went into a holiday already at a peak. So will we see even more cases after this weekend? I hope people did their part to stay safe. So stay tuned. This might be just what we've been hoping to see for a while, or it's just as possible this is a mere blip in the upward trend after a holiday weekend. So be well and be careful still right now.